everyone, welcome back to Pramay English. I'm Tuhina. We are at SUM Ultimate Medicare Bhubaneswar, and as we know that Breast Cancer Awareness Month is underway, so we have with us Dr. Chira Ranjan Khadanga, Senior Consultant Radiation Oncology, SUM Ultimate Medicare Bhubaneswar.
Namaskar. Myself, Professor Dr. Chira Ranjan, Head of the Department Radiation Oncology, SUM Ultimate Medicare. October month is observed as a Breast Cancer Awareness Month because the breast cancer incidence is rising gradually in our country, our state. But the thing to know is breast cancer is curable if detected early and treated properly. A patient after a complete treatment can lead a good quality of life. So, in order to promote the awareness, promote the concept of treatment and post-treatment quality of life, we generally observe October month as a breast cancer awareness month.
What signs or symptoms should prompt someone to seek medical attention?
It's a good question actually. So first I would like to tell everyone who is watching this that we should know our human body first. We should know our organ, and if there are some abnormality like any abnormal lump, hard lump, or any abnormal discharge, that is specifically bloody discharge, red color discharge from the nipple, or any change in the color of the skin or any texture or size, then it should prompt us to go for a screening examination.
What are the tests that can be conducted for early detection?
The early detections are first is the self-examination. If some abnormality are there like abnormal lump, hard lump, or any bloody discharge or change in the skin color or change in the size, then the first investigation should be done is the mammogram. Mammogram is nothing but a X-ray examination of the breast which generally detects any abnormality, specifically the cancer. If mammogram shows any abnormality, then we should go for a biopsy. That means inserting a small needle, just like we are giving an tetanus injection in our arm. Similarly, a small needle is inserted quickly to take a small chunk of tissue to examine whether it is a cancerous or not. If it is cancerous, then we are advising further tests to see whether the disease has spread to any other organ or not, like lungs or liver or bones or brain, something called staging workup.
Is there any specific age at which women are most commonly diagnosed with breast cancer?
So epidemiologically, it has been seen that women of more than age 45 to 50 years have a high chance of developing breast cancer. But sometimes we also see young patients at an age of 25 to 30 years rarely develop breast cancers. So my message to the viewers are, if there are some abnormality, they should not neglect. They should seek the medical opinion or medical consultations.
Is it true that breastfeeding reduces a mother's risk of developing breast cancer?
Definitely. A long history of breastfeeding or breastfeeding to more than one children generally reduces the risk of breast cancer, because during the process of breastfeeding, the estrogen hormone, which is the predominant cause of the breast cancer, that hormone level in the blood that decreases during the breastfeeding and during the pregnancy time. So more the duration of breastfeeding, less the chances of having breast cancer.
Is the breast cancer hereditary?
It has been seen that almost 10 to 15% of the breast cancer patients harbor a gene mutation, means a change in the genetic material, something called the BRCA1 and BRCA2 gene mutation, that makes them prone for developing breast cancer. So the message is, if a woman whose primary relative like mother or mother sister or own elder sister is having breast cancer, they should be more careful for any abnormality happening in the breast.
What are the main risk factors for developing breast cancer?
So medically, we generally classify the risk factors as a modifiable risk and non-modifiable risk. Modifiable risk means the factors which can be modified with active intervention. So that modifiable causes of breast cancers are obesity, which happens due to lack of exercise and excessive intake of fat, vegetable fat or animal fat or excess salt, lack of exercise, lack of hygiene. So this is, and second non-modifiable breast cancer is the age. More advanced age, more probability of having breast cancer. So the message is every female should be careful about her own body weight. Something we scientifically decide, something called body mass index, that should be less than 25, or a simple message or simple word, the body weight should be under control. There should not be any obesity, means excess fat deposition, and if anyone is taking excessive fat or oil or salt, that should be checked. And the non-modifiable breast cancer causes are the any genetic mutations present or advanced age. So these are the things.
What are the current standard treatment option for breast cancer?
So it's a good question actually. So it depends on the stage of the disease and the molecular status or molecular conditions of the disease. If stage 1 disease, then only surgery and sometimes hormonal therapy and brachytherapy is the standard of care. If it is advanced disease like stage 2, stage 3, we generally use the trimodality treatment like chemotherapy, hormonal therapy, surgery and radiotherapy. If it is a advanced disease, stage 4 disease, generally we give chemotherapy, hormonal therapy and targeted or directed radiotherapy. Suppose brain metastasis is there or painful bone metastasis is there, so we are giving a targeted or directed radiotherapy.
Is it curable?
Yes. My message to the viewers is breast cancer is curable if detected early and treated properly.
Have there been any recent breakthrough or promising development in breast cancer treatment or research?
Yes. So recently it has been seen that in BRCA, germline BRCA mutations, a new treatment called PARP poly-ADP ribose inhibitors like olaparib or niraparib for 2 years that improves the survival. Sometimes intraoperative brachytherapy that decreases the total duration of the surgical treatment, which improves the quality of life. And we are also offering this intraoperative brachytherapy treatment using modern Bravos brachytherapy machine at SUM Ultimate Medicare, which significantly reduces the total treatment time and improves the post-treatment quality of life.
With Breast Cancer Awareness Month in progress, what are some effective ways to raise the awareness?
So, breast cancer generally happens more in the women of age more than 45 to 50 years. And second thing, breast cancer probability is more in the obese females, and breast cancer probability is more in nulliparous, means who does not have any children, or there was some problem during the breastfeeding, or any family history of breast cancer. So I would request everyone to do the self breast examination at least once in every month. If there are some abnormality, should go for a medical doctor opinion or consultation. And every woman more than age 45 to 50 years should undergo an annual breast cancer screening test.
Is there a message you would like to share with our audience?
Cancer is curable, breast cancer is curable if detected early and treated properly. So awareness is the key to a good health.